Monday morning in the hospital ward in Dar es Salaam in Tanzania. Mr. Adenani travelled 600 kilometres to get to this hospital. He has lived with diabetes for 25 years, often with no treatment at all. Now he has no choice. He has a problem with his foot.
Kati vidole viwili vitatu, vidole cha kwanza, cha pili, cha tatu, mpaka hiki cha mwisho hiki, kwamba hivi havina ile transfer ya damu, haipo.
The wound was inflicted months ago when he stepped on a burning charcoal. When the dressing comes off, a distinct smell of rotten flesh fills the air. It's a common smell in Ward 23.
This is the top 10 disease in this ward. Number 1 is intestinal obstruction. Number 2 is diabetic mellitus.
Na vitu kama hivi vile vile ndio vinavyotukuta kwa sababu tunavifanya kienyeji, naona hatupati elimu ya kutosha. Hicho ndio kitu ambacho.
When people with diabetes do come to the hospital, they may find a healthcare system burdened with its own problems.
The healthcare systems are still not geared towards non-communicable disease or diabetes. They are mainly geared towards the infectious disease. There's a lack of awareness of the disease itself and the symptoms. There is also lack of adequate education and knowledge about how to pick up the symptoms and signs.
Education is a major task for the World Diabetes Foundation. It supports projects in the world's poorest countries. This is because the problems are so huge and difficult to solve. A person with type 1 diabetes will die if not given insulin. A person with type 2 diabetes may live untreated for decades, while the disease progresses into life-threatening complications that will bring the patient to the hospital. In India, pregnant women are gathered to be checked for a temporary form of diabetes that can harm both mother and child. Poor blood circulation in the eyes can lead to blindness. Other serious risks are kidney failure, heart attacks, and the amputation of legs due to gangrene. All of these complications are easily prevented by educating the health providers and by finding the people who are silently suffering from the disease, finding them before it's too late. Wednesday in Tanzania. Diabetes is about to claim yet another amputation. Worldwide, this happens every 30 seconds. Surgery can begin.
You see, we can't amputate it through here because already there is pus. Kwa njia tu ya kukusaidia tukate huku juu ya goti.
Juu ya goti.
Juu ya goti. Goti si hili hapa? Juu kama hivi hapa juu ya goti. Nakubaliana tuendelee?
Niamua kuliponyesha kama kidonda kinataka kupona.
Outside the hospital, new problems await Mr. Adenani. How to afford an artificial leg? How to live and work without one? Who will help keep his family alive? In the West African country of Cameroon, 1 in 4 people in the cities are obese and therefore at high risk of developing type 2 diabetes. This diabetes clinic in Yaoundé was established with the support of the World Diabetes Foundation. The aim is to prevent type 2 diabetes and its complications.
Donc il faut faire tous les jours un peu d'exercice physique pour essayer de faire travailler votre organisme à rejeter l'excès de poids.
Next door, mothers and newborn babies are gathered. Knowledge about diabetes may save this coming generation from the burdens of the disease.
It's really the long-term kind of prevention that we also like to see, because If we can avoid people getting the disease, it will be much easier than if we have to treat them once they got the disease.
I think if you want to give children with type 1 diabetes a long quality life, how they can live comfortably, I think we as healthcare providers need to have a right environment to nurture them, to teach them, to provide them with whatever is necessary to make sure that they attain optimum blood glucose control. They are able to delay their complications and able to live comfortably for a longer period of life and become more productive.
We visit Mr. Adenani after the operation, but he is not able to speak. The operation has weakened his body, and his blood glucose level is out of control. The following morning, just before sunrise, Mr. Adenani dies, leaving behind 2 wives and 6 children. Friday in Tanzania. A day like any other in a world with diabetes.